And with that, I'm going to read a disclaimer because I want to be within compliance here today. Always consult your physician. Although these are doctors on this call, they're not your doctors. So that's important to know. Or a qualified healthcare provider before embarking on a new treatment, diet, or fitness program. We assume no liability or responsibility for damage or injury to persons or property arising from any product, information, idea, or instruction contained in the materials provided to you. It's important for people to know that those that have listened, I was given an anxiety medication because I had a very sick wife for 3 years. I lost my short-term memory. I had an anxiety attack. I was really, really concerned backing up about 20 years ago. Had no idea I'd be addicted to an anxiety medication 4 days later. Had no idea patching would allow me to get off of them in month 4. But I'd like to add across 2 states, 2 physicians that were prescribing them, not one over 18 years ever helped me get off of it. None of them tried to get off it. Help me get off. Not one of them said, hey, Rich, if you're on this for a long period of time, you have a 50% increase for dementia. Not one of them said, hey, by the way, if you're drinking alcohol, it could be lethal. So these are all things I learned after I got off of clonazepam, generic for Klonopin. So I want to give people hope that are listening because I never thought I could get off of it. I never thought I could stop using testosterone after 13 years and spending $6,000 a year for 13 years, that I had another option. But when my blood test came back showing I didn't need any longer, number one, but number two, that nothing was wrong with my blood for the first time, and I'd done quarterly blood tests for 13 years. It was 5 months after patching. So nothing had changed except I started patching. And learning from your book, Dr. Harmon, is we have over 80 peptides in our body. So this is signaling our own body's peptides. Google GHK copper peptide. That is the peptide that allows your body to do some really special things. It's the fountain of youth. So I'm going to skip next to Dr. Kneller because Dr. Kneller is a cardiologist and he's done some research with some heart patches, and I'd like him to share a little bit. He's published that. Dr. Kneller, if you would, please.
Yeah, thanks. So, I've been interested to explore what we can quantify in terms of heart function with the patches, and probably most exciting is an accepted abstract to the American Heart Association, which will be this November 16 in Chicago. So I've got an accepted moderated poster on the effects of some of the heart patches on improving heart function acutely. So what we did is over the heart on the left side of your body, we applied multiple patches to max out the effect, and then at baseline before doing that, performed an echocardiogram of the heart to quantify heart function, and then repeated that ultrasound 30 minutes after applying multiple heart patches over the heart. And we were able to quantify that on average, the squeeze function of the heart, commonly known as the left ventricular ejection fraction, improved by 6 to 8% on average across 30 volunteers, age ranging from 45 to 85.
Wow, that's a big
that's a
deal.
Huge result for cardiology, and that's something that the American Heart Association would appropriately get excited about.
Yeah, I get excited about it. I'm going to interrupt you real quick. Those that are listening, this is a non-transdermal patch. So if nothing goes from the patch in your body, Dr. Kneller, that means your body is 100% working to heal itself. The patch allows your body a boost, if you will. And you have shown that by applying these patches around the heart and testing within 30 minutes, if I can use efficiency of the heart improvement, what percentage?
Squeeze function, on average 6 to 8%.
Wow.
But some people as high as 12 and 14%. So some astonishing results in individuals, but across averages, we can probably say 6 to 8% on average. And again, that's a tremendous shift,
Now, I'm going to just go off the cuff here. There's been a lot of people we've run into going across 16,000 miles since we left Arizona. Jeff and I got an RV and we left Arizona. We've gone 16,000 miles. 4 weeks of that, it sat in Toledo, Ohio, and we've seen a lot of people. And I'm a financial advisor spending 70% of my time doing financial planning. So I'm doing this part-time. And we've seen a lot of people concerned about their health after COVID. And I'll be direct, after they got a shot. And can I ask you, because I've referred several people, those that are listening that are concerned about their heart, can they contact you through Natural Heart Doctor, or how do they get a hold of you?
Yeah. So Natural Heart Doctor is a holistic cardiology practice out of Scottsdale, Arizona, where we see patients specifically for the purposes of trying to find alternative therapies to add to their cardiac therapy, hopefully to replace pharmaceuticals and help folks become more natural and to discover root causes of their disease. So that's Natural Heart Doctor through Scottsdale, Arizona. I'm also in a conventional cardiology electrophysiology practice based in Lake Havasu, Arizona. So conventional therapies on your insurance, come see me in Lake Havasu, Arizona. Once we've established once, we can do the rest through telehealth anywhere in the country. Natural Heart Doctor, we are doing second opinion consults for cardiology patients all across the country and in Europe. So that is something where the initial visit can be a Zoom call. So that is available to anybody on this service through Natural Heart Doctor.
Fantastic.
Otherwise, come visit me in Lake Havasu anytime you like.
I'm going to ask thank you for that. And those that are viewing, reach out. I know I've referred several people that I've run across with big time concerns. And I've interviewed some amazing stories, including Dr. Harmon, what he's experienced with his own heart issue that he's had personally since patching, and that has gone away. Correct me if I'm wrong, Dr. Harmon.
No, that's correct.
Yeah, and then we've got Dr. Greg Chambers in Arizona, who literally died for 9 minutes. He's a walking miracle by himself. But after patching, his cardiologist could not find any history on his EKG of any heart attack. And that was about 6 months after patching, if not less. So pretty amazing. On a professional side, Dr. Cannella, could you talk or speak to the healing process you've noticed with your patients that are patching? Because I remember you showing me some photos of that.
Yeah, so we've used the patches to accelerate wound healing in several examples from my clinical population. For people who are interested in complementary therapies and looking for natural adjuncts. And we have one of those studies accepted for publication in the Journal of Innovations in Cardiac Rhythm Management. And following a pacemaker wound extraction for infection, for example, leaving a big crater wound, we were able to demonstrate that with the application of X39 next to that wound, that it healed 50% faster compared to what the wound care services following the patient would have anticipated. And then on the heels of that, another study, which I'm expecting to be accepted very soon, a very large hematoma around a device, for example, with the combination of 3 different devices acting synergistically, we achieved a 500% increase in healing time compared to what expert consensus would have predicted for that situation.
Wow.
So we've seen some dramatic improvements in wound healing from our experience. Those are individual case studies, but it's individual cases that do convince the mind. And we've seen some pretty astonishing results, and some of those will be available in the mainstream medical literature shortly.
So, Doc, may I ask a question?
Sure.
Was it 500% faster healing? Is that what it was?
Yeah, then
Okay.
anticipated. So you have a wound, you share it on social media among the electrophysiology community, and you say, start to finish, expert consensus, how long would you folks anticipate that this would take? And the average estimate across 46 responders was 4 to 5 weeks. Looks like about a 4 to 5 week healing process when the pictures were taken 6 days apart.
Wow.
Yeah.
That's fantastic.
That's a big
Congratulations. That's
That-
awesome.
Yeah, it's very hard to standardize wound healing, but certainly that recovered much faster than anyone kind of would have predicted.
So gentlemen, correct me if I'm wrong, the patches allow your bodies to produce more collagen. which helps in the healing process, correct?
Well, the GHK copper peptide is known as the emergency response peptide. Why? You have to patch things up. You have to grow new capillaries in order to get into the wound where there's no blood flow, and you need to activate stem cells. Emergency response, that would be a wound, and all of a sudden you have all of the resources, you have the stem cells, you have new capillaries, it chemo attracts capillaries into the tissue that has none. So obviously it's going to heal much faster if you can get in raw materials and oxygen and everything else to it.
Thank you for that.